My name's Hunter Miller. I'm with the class of 2018. I did my internship at Sweetbriar College in Amherst, Virginia. All right, so Sweetbriar College is it's in the ODAC. This is the Fitness and Athletics Center where I worked day to day. It houses the athletic training clinic, coaches' offices, um, indoor tennis, basketball, and track, along with the Red Room, which is what they called the athletic strength and conditioning room, as well as the campus gym. All right, this is my preceptor, Devin Serrano. She has her doctorate in athletic training, which she got from Indiana State University, which is also the first Katie accredited doctorate of athletic training program. Got her master's at Bloomsburg University of Pennsylvania in athletic training. Got her bachelor's at the State University of New York College of Cortland as a kinesiology major with a concentration in exercise science. Um, Prior to Sweetbriar, in she worked for Auburn University Warrior Athletic Training Program at Fort Benning, Georgia, with the First Battalion, 50th Infantry Regiment. She also worked at University of Louisiana Lafayette. Her primary sport was volleyball. Secondary sports were football, softball, and women's basketball. She also did an internship with ESPN Wide World of Sports Complex at Walt Disney World, Florida. Uh, Research areas of interest: mental health, concussion, equestrian, athlete care, and women's health and physical well-being. She is currently doing a 4-year study on equestrians, having them perform uh, surveys and functional screening assessments twice a semester. She is also the only athletic trainer at Sweetbriar College and is responsible for the health care of 96 student athletes, give or take. She is also the Title IX representative of athletics. So, around campus she wears several different hats. This is the athletic training clinic. This first picture here on the left is as you enter the athletic training room clinic. You see the table. It's got the laptop. We use the laptop for patient sign-ins, where they sign in. They give their name, sport, injury, side of body, all that stuff, and it all gets processed and put into a Excel file that we can later look at to write down in their paper files, which later then get put into ATS. So it's a good tool in helping us just keep track of everybody and what's going on and making sure we get everything documented correctly. You also see on the desk, we have that white folder binder that has all of the dash scores, personal outcome measures, scat threes, and our eval forms, which we have separate eval forms for lower extremity, upper extremity, any kind of trunk injury, head, neck, spine injury. We have all kinds of stuff, and you see we have a treatment table there, and the picture on the right shows just kind of over from all that. We have big open space where we did all of our rehabs. In the back corner, you can see, where we have the stand with our, you know, game supplies. We have the kit, splint bag, AED, a big a portable eval table, crutches, all that stuff for in game. We also have, as you enter that door and look to the right, you have these 3 taping tables. Um, in the back left corner of the clinic, we have our wet room, or wet area, which has two functioning whirlpools, water bottles, coolers, all that stuff. We have a dishwasher, which was awesome. You just load them up at the end of the day, turn it on, come back in the morning, everything's clean and dry and ready to go. The little white freezer on top of the dishwasher for ice cups and things of that nature. We also have, nice sized ice machine and that little three-step staircase we use for rehab. Across from the wet room, we have this area right here where we have three treatment tables. In between the two tables, we have a e-stim and ultrasound combo machine. On the other table there, we have an ultrasound machine. We have the Hydroc, all of our Hydroc pads and stuff. The little white cart has all of our like general medical just supplies, Neosporin band-aids, you know, hydrogen peroxide, uh, something similar to Tiger Balm, so our icy hot, all that good stuff right there. All right, then when you walk past that little white cart and turn to the right, you get this little hallway that leads to our supply closet where we keep everything. We have a whole bunch of boots, a whole bunch of crutches. We have baskets of braces and padding, and along with all of our Ace Wrap's other supplies, which were basically donated to the clinic once the on-campus health facility got shut down. Um, Also, as you walk into the clinic and turn directly to the right, on the way to those three taping tables I showed earlier, you have a wooden door. You open it up, and it's this here on the right. It leads directly to the health and wellness center for the campus, which was a great tool for us. We'd go in there and we do, rehabs. Through that little doorway there, you can see a bunch of cardio equipment, which we also use for rehabs. All rehabs were required, to do 10 minutes of cardio to warm up before beginning their rehab program. So this was a nice open space where you can come in here and do some more advanced exercises, use it for like return to play, uh, concussion, functional exercises. Uh, Used it to rehab a dancer with the pads, so she could practice handstands, flips, all that kind of stuff. Um, Nice open area. We throw an agility ladder out and have them do agilities for some more functional type training. It was a great tool to have. Then our different sports venues on the left here, we have the field hockey field, which we covered their spring ball, uh, practices and stuff. We also have here the lacrosse field, which is also the soccer field in the fall season. Uh, then, as you walk out the glass doors in the back of the clinic, you have the tennis courts here. Standard six courts. I think these courts are relatively new. They were built last year. Then, on the other side of campus, you have the barn, which is the equestrian area. It has, the barns, stables, and everything's for the horses, as well as the riding center here, where they're doing some of their floor work. So, with my experiences at Sweetbriar, it's an all women's college, so that was definitely an adjustment. Um, until about a month before I was done with, my internship, there was only two males working in the athletic department, me and the tennis coach. Uh, right before I left, the SID came in and began working. Um, so there was three males and a in the athletic department for this college. Uh, some interesting injuries I you know had to deal with. Rehabbing a patient who had a Bankart repair done. She also suffered from POTS as well as Ehlers-Danlos syndrome. and had, several other uh, genetic issues that we had to accommodate for in our rehab program. Um, this athlete was really interesting, just because she had these, POTS and Ehlers-Danlos syndrome, but she was also a dual athlete in three or four different clubs, and she was a dance major. Her two sports were field hockey and softball. She also helped fill in with lacrosse when their numbers got down, if need be. So rehabbing this individual was very interesting, since she was a senior and out of sport. Um, since softball was moved down to a club sport. We focused mostly on the dancing since she had three or four more shows she had to do before the end of the school year. So, that was interesting. I've never had to rehab a dancer before. So that posed some interesting challenges along the way. We had a lacrosse player who had torn lateral ankle ligaments. She suffered this injury after rolling her ankle for the second time during the season. Completely tore ATF and CF ligaments in her ankle, but she was allowed to continue playing as long as she could tolerate the pain. Uh, that came from the team physician orders. This athlete obviously just had to play either with her ankle taped or braced, and is to undergo surgery sometime in the summer, I believe. We also had a patient with a meniscal tear, patient who had chronic plica syndrome that we had to deal with. We had lots of concussions as well. We probably had 8 to 10 concussions while I was there. Half of those were actually like non-athletic related. So we had a couple patients who suffered, who had car wrecks and things of that nature. But we it was a lot of work with some of them. And we also had a swimmer who had Lyme disease with co-infections and a blood clotting disorder that was thought to have come from the Lyme's disease. Uh, this athlete was interesting to work with, to say the least. She had a lot of bruising issues, and some had a time or two where she began to clot, and we had to go to the hospital to get treated. But she was able to complete her season and actually place on the podium at ODAX, so that was awesome. Sweet Briar, it is a good internship site. I would advise it. Um, I felt like I had everything I need to prepare for the BOC exam. Devin was nice enough to allow me to use her personal library and all her textbooks and resources she had to help me to study for my BOC exam. Lots of hands-on experience. I dove right in. She threw me every eval she had. Um, I did almost all of the concussion evaluations. I mean, it was very just hands-on. I got to do everything and anything under the sun here. It was awesome. We had designated days at first where I would run the clinic, and then it got to the point where I basically almost just ran the clinic all by myself. I got a lot of hands-on experience, a lot of experience with medical documentation, things of that nature. I mean, I stayed busy since we were the only two covering almost 100 athletes. Things did get pretty crazy. The only thing I would advise is, be careful with some of these athletes. I mean, they will, if a male student does go out there, they will try to flirt with you, etc. You just kind of have to ignore it, push it off to the side. Devin and them are very receptive to, if you tell them something's going on, they'll address it and talk to the athlete and end it. But overall, this is a very good internship site, and I do recommend it.